September 2015, the General Assembly of the United Nations adopted the 2030 Agenda for Sustainable Development that includes 17 Sustainable Development Goals. Building on the principle of leaving no one behind, the new agenda emphasizes a holistic approach to achieving sustainable development for all. One of the goals that we are focusing on is the third goal, which is good health and well-being. This goal is being implemented due to several factors. For example, the burgeoning issue of world poverty. This issue has been around since the dawn of time, especially in countries that are less developed, where healthcare is not an option. Diseases will be ubiquitous, leading to epidemic and death. For example, countries in Africa suffer the most from this. Imagine, a disease that can be easily treated such as malaria has taken millions of lives in Africa. Due to poverty and lack of proper medical healthcare, the death rates due to malaria are so much higher compared to other countries with proper healthcare. Under the target of good health and well-being, there are many sub-goals that need to be achieved. Amongst them are achieving universal health coverage, which includes financial risk protection, quick access to essential healthcare services, and affordable medicines and vaccines for all. In addition, it aims to substantially increase health financing and recruitment, development, training, and retention of health workforce in developing countries, especially in least developed countries and small island developing states.
People have taboo about word hospice, and people felt if I get my family members to be cared for by hospice, they are going to die sooner. That is our first challenge, to reach out to the people to say no, hospice is not about making people die faster, but actually making the quality of life better.
Some of the stories about these nurses who could, easily work in a hospital, where they just went to work, went to the hospital, did their work and then came home. But they travel a long way and go and see these people that are in the last stages of their life at a really difficult time for them and their family. It's really hard work, both physically demanding and also mentally and emotionally, and yet they have these beautiful hearts.
Different person have different perception on beauty. I feel a person beauty is the inner beauty that I see in the doctors and the nurses in the hospice. I think the beauty in them is bringing joy to others, to the patients, and when we see others happy, we eventually also get affected by the happiness.
They give this for free. It's a non-profit organisation, and there's not a lot of support in society for that. And to see these people courageously standing up and saying, this is a need that needs to be met, and we're going to go and do something about it.
I never knew that I liked painting. I saw a little girl who's struggling for life, and she did wonderful paintings. So I see if the girl can live such a meaningful life, why can't I? She's not giving up her life. It wasn't easy, but I think as long as we have hope in our heart, I think we'll go through the process. There's a reason I think I live for my loved ones. As long as there's a hope in the patient's heart and there's a will of living, there's always a better tomorrow. Where there's love, there's always time, and there's nothing is impossible.
Good afternoon.
Dr. Siu, thank you for agreeing to participate in this online interview. My name is Kai Wen, and I'm the leader of this group. Shall we begin the interview? If you are okay to start, I will pass it to my teammate Refat to start the first question.
Okay, I'm ready.
Okay, thank you, Mom. First of all, thank you so much for attending this interview. May I ask you some questions, please? The first question, could you provide us an insight of the history of this organization, please?
Sure, yeah. We're talking about Kasi Hospice Care Society, yeah?
Yeah.
Okay, we were originally established in the year 1997. So that is almost 23 years ago, as simply a community service group set up only by volunteers from all walks of life who had the wish to provide companionship and emotional support to people who suffer from mainly cancer. And only in 2005, then we realized we need a full medical team to provide a holistic medical team to care for this patient. So in the year 2005, about 14 years ago now, we then registered as a society and started providing a full medical team to provide a hospice service to patients who were referred to us, a full home care hospice service, which means a holistic care to people who are facing the end of life. It's a specialized professional care, what we call end of life care.
Oh, that's so interesting, Mom. Okay, thank you so much. The second question, throughout the years, what achievements have this organization accomplished?
Okay, all right. Okay, let me talk about from the year 2005 to 2019. We have, from the year 2005, when we first started, we care for just about 30 patients. And comparing to 2019, last year, we care for almost 1,000 patients. So I would take that as quite an achievement, even though it's been over for almost 15 years. It has taken us a lot of effort and work to actually educate and bring public awareness. Beside public awareness, actually to educate even professionals like doctors in the hospitals to understand the service that we are providing, so that they will actually refer patients to us. These are the patients when they say to them, unfortunately, when the doctor say to the patient that you have something untreatable, there is nothing more that we can do for you in the hospital, and they are sent home. And these are the patients that should be referred to a hospice group to take over, so that the family know how to manage them at home, to give them the comfort, symptom-free relief of the suffering for whatever remaining time they have. So our service include empowering and teaching family member of how to care for patients, beside the nursing medical care that we are providing to the patient when we visit the patients at home. So we have definitely seen an increase in the number of patients, also mainly because we are able to recruit more nurses to provide such care. Yeah, and at the same time, we also have a group of volunteers who continue to provide emotional and companionship to patients, mainly in oncology ward, cancer ward, in hospitals, mainly government hospital in the Klang Valley, Hospital Besar Kuala Lumpur, Selayang Hospital, where our volunteer will go in either on a weekly or on a monthly basis to sit with the patients, yeah, to provide emotional and spiritual support to this patient and also the carer.
Oh, okay. Thank you so much. Please give me the opportunity to ask you this question. What made you volunteer to help in this organization?
Okay, I have been volunteering with Kasi Hospice Care Society since 2006. It's been over 14 years now. I always believe in this desperate need of the availability of end-of-life services and care to patients like what I have described before. These are the patients who no longer by Western medicine of untreatable conditions, and we are continuing to educate that palliative medicine hospices should be included as the mainstream of part of the care that medicine should provide. So that's my passion, and that is a cause that is very close and dear to my heart.
Yes, yes, you're right. Okay, the last question, and then I'll pass the mic to my friend. Okay, approximately, how much money do you raise each year?
Okay, running a service like this, when you have a full medical team, it's a very expensive affair. As our medical team, as our number of nurses and doctors increase, naturally the expenses increases.
Of course.
So just to give you an idea, it cost us about $1 million last year to run the service.
Yeah.
We have a team consists of 2 doctors, full-time doctors, and 6 nurses. And the 1 million go out to over 4,000 home visits that we carry out in the year 2019. And we cared for 983 patients in the year 2019.
That's
really, of course,
that's really nice.
if in the earlier years the expenses were less, that was because our team was much smaller, and also means the number of patients we could reach out to was equally smaller.
So you're saying like if you have more, like if your team more people, you will gain more money.
We would need to raise more money if the team is bigger to pay the salary, because our medical professionals are on our payroll.
Yeah.
Yeah. So the volunteers are different group of people who help in the service. The volunteer, of course, are not paid. They are volunteers. But our professional medical team are on our payroll. Medicine as well as medical equipment that we loan out or given out to patients free of charge. These are all from the fund that we raise, mainly from the public.
Oh, okay. Thank you so much. I was Rifat Hatim Al Sai. Now I'll pass the mic to Derek.
Yep. Hi. So my name is Derek. I'll continue with the second half of the interview. So I would like to ask, approximately how many people do you help in each year, like the average?
Okay, so I think I mentioned earlier at the very big, in 1997 up to 2005, we only had volunteers who go out to provide emotional support. This will be, we are talking about 50 to 70 active volunteers who are actually divided into like different groups, visiting different hospitals, different wards. I don't really have the figure of the patient we reach out to, but we have clocked in more than 30,000 of man hours over all this number of years. But if you talk about the patient directly that we are caring for them, since we set up the medical team in 2005 until now 2020, of course 2020, I could only give you the figure in 2019. So from 30 patients we help in the year 2005, it has been increasing to 100, 200, 300, 400, and last year we cared for almost 983 patients.
All right. So I'd like to continue with the next question. Why do you think, in your opinion, why is this issue is important to address worldwide? Like,
okay, there is some figure that at any one time, 4 out of 10 population people in 4 out of 10 people, there are studies to say 4 out of 10 would require palliative care at any one time in each of our lifetime. So that's a huge number. And there is a figure to suggest only less than 14%, about 14% of these people actually get palliative care or hospice services. And these 14% are actually people who are in a more developed countries. So what I mean is in Malaysia, we are only catering for about 10% of people who rightfully should have the right to this kind of services. So we are way below. And there's a lot more patients that we have not been able to reach out to. So the patients are there, except our team is so small, we are unable to cover everyone. Very often, phone call comes in and say who and who, my father or my uncle or my mom has been diagnosed to have stage 4 cancer, and doctors say there's nothing else they could do, and we are to take my mother home. And we stay here. Say they, for example, they stay in Bukit Beruntung, which is about 50 kilometers out of KL. Not everyone get covered. Yeah. So it may be outside of our area of coverage, and we have no choice but to turn down. But there are always patients. There is enough patient for the 3 hospices in the Klang Valley to cater for the patient who need this kind of help.
yeah. So based on this question, right? How do you think that we can help to raise awareness and spread this awareness to others to volunteer to help?
Oh, okay. I think first and foremost, I think for you all to actually choose Kaseh Hospice to interview, I think it's already a big step for young people to actually think about, you know, to even getting to know about hospice. What is hospice? Usually, you know, young people don't really want to care about, you know, talking about illnesses, talking about dying, talking about old age. Yeah. So I think just you chose to do this interview with us is an awareness you are creating among the peers, among your university. I think even I hope while you're doing this interview, you also look into more information about palliative medicine, about hospice services, and maybe you could talk to your friends or talk to even your parents about, you know, hospice services. I think that is already wonderful. Of course, there's many more things that we could do. Yeah, but that's good, great starts.
Okay. Yeah, I'd like to ask a last question. Do you have any like difficulties or any obstacle like during this COVID-19, this pandemic? Like, I think there must be difficulties, right?
Yes. We were just sharing. Of course, we are already in RMCO now, right? If we back the clock to early March or even late February, at that time when the things were just becoming to get even more serious, because we are a home service that we provide outside of hospitals. So we are not actually being, in a way, when you are in a hospital, you are protected in the sense that people who come into the hospital would be screened. and doctors and nurses and any other medical staff in the hospital would be provided with PPE and protected. Yeah, but for us as our team going out to see patients, of course, we managed at the end to actually we had problem even buying masks for our medical team, for our nurses and doctor, but we put out a post on our Facebook and asking, because as you probably remember in March, it was so difficult, probably also for you all to buy masks from any pharmacies.
Yeah.
And because hospices are not quite in the mainstream of being a hospital or being a medical center, so we don't have special supplier to provide us with masks, even if we want to buy. So we were very impressed and very touched when we put out a post and say our medical team would need face masks, we would need PPE, and we started getting a lot of attention from the public and people walking into our center with 10 pieces of masks. The extra that they had, they managed to get from pharmacy, and then we also started to get from corporation and some suppliers sending us, enough masks and gloves and also PPE to protect our staff. So that was the beginning of the challenge. The second challenge, I would say, was during the beginning, everyone was unsure of what we are facing. And the general knowledge and precaution that people take. And also we are dealing with patients who may be just discharged from hospitals. And as you know, hospital will probably be an area you do not want to be exposed to during the COVID. Yeah. So when these patients are being discharged, we don't really know, not that every time a patient is discharged, that we get to know whether they are exposed to maybe potentially been infected. So we actually had to go in to see patients in the full gear. And that, of course, indirectly caused an increase in cost to us, as well as a lot of worries and concern. Yeah, we have, to the extent we have family members of our nurses who were very concerned about their daughter, wife working, exposing themselves. So I think that was a challenge, but fortunately, we are now in a much safer situation now. Yeah. So we managed to continue to see them, and a lot of the visits were not able to carry out if they were not very urgent. So a lot of the review actually was through phone calls or through video call to patients and their family. So we are happy to say that we managed to continue the service even during the very severe time, during the whole MCO, the last 3-4 months. Yeah.
Right. So thank you for answering all the questions. Kaiwen will say something to finish up our interview.
Okay.
All right. Once again, thank you for participating in this interview. You really opened our eyes on the matter. Lastly, would you mind if we include your organization YouTube video in our documentary?
Sorry, I didn't get you about some YouTube. I didn't hear what you said.
Would you mind if we include your organization YouTube video in our documentary?
I think there shouldn't be any issues. Yeah. This documentary is mainly for your project,
assignment.
right? Yeah. Yep, I think it should be no problem. We are happy to reach out to more and to be able to educate people on the service that we are providing.
Thanks for your participation in our interview. We are glad to have this meeting with you. Thank you.
Thank you so much. Yeah, all the best.